So today we're going to talk about the Understanding MS Massive Open Online course, and I'm going to be talking about a little bit of what we found out so far in all of the research that we do around the course, which there's a lot going on, but I'm just going to talk about a little sliver of it. And then Jodi's going to talk about how the things that we found in our research impact services and how we provide services and how you might think about doing that as a service provider, or even in some cases in a healthcare context. Let's see if I can get this to do what I want. Yay. So what is the Understanding MS Mooc, or Massive Open Online course? Well, lots of you in the room have taken the course, and even some of you in the room star in the course. We see a lot of familiar faces in the room. But for those of you who aren't familiar with it, it's a freely available online course that walks through various aspects of MS, starting at the underlying biology and pathology, all the way up to its impact on everyday life. And what's the goal of the MOOC? Why did we build it? What were we trying to achieve? Well, the main goal of the MOOC is to improve and increase people's understanding and awareness of MS, both in Australia and around the world. And so then the main goal of us studying the MOOC is to see whether or not we've actually achieved that. Have we met our goal? Have we approached that aim? And also, along the way, gain a better understanding about MS-related knowledge. So how do we go about doing that? How do we study the MOOC? Well, we do it in two major ways. The first way is that we run cohort studies around each enrollment of the MOOC, and that means that we ask a group of people who have enrolled in the MOOC to do assessments before they start the course, immediately after they finish the course, and then 6 months later after the course is over. And that lets us look at differences over time, so we can see whether or not people are actually learning anything in the course, fingers crossed. And the second way that we look at the course and we sort of study its effect is we gather information from people when they're actually taking the course. So just in the normal process of being a participant. And that's information that we gather around specific things that we ask people in the course, in discussion boards and other ways. And also just around engagement. So just seeing how people engage with the course. And so one of the main things we've learned is that people living with MS know a lot about MS. I don't think that's a surprise for the people in this room. People living with MS are experts in MS. And so we assessed people's knowledge of MS before they started the course, and what we see is that people living with MS know significantly more than people not living with MS, but also, let's see if I can work the laser, I'm always terrible at the laser. What we see here is that people living with MS have higher than average knowledge of MS across the whole group, but also they're the second most knowledgeable group of any of the subgroups, second only to specialist healthcare providers. So they know a lot going into the course. And then when we look at how knowledge changes over time, what we find is that thankfully, the MOOC does teach people about MS. What we find is among people living with MS and those not living with MS, everybody learns more about MS and knows more at the end of the course than they knew at the beginning, which is great news after years of work. But among people with MS, we also see an uptick in some other outcomes. So we're also checking on a few other things. And what we see is that among people living with MS, health literacy, which is the ability to find and use health information and to navigate health systems, and self-efficacy, which is the belief in one's own ability to do things, also tick up after the course among people living with MS. And those upticks are more modest than the upticks in knowledge, but they're consistent and they are retained 6 months after the course finishes. So does that mean that MS knowledge is related to those other outcomes that we saw that uptick into health literacy, into self-efficacy? Well, we're researchers, so we're the type of people that just can't let well enough alone. So we wanted to find out, and we hypothesized that it would be. We've got MS knowledge here in this little flow chart, and it's connected by a bunch of lines to things like health literacy and self-efficacy and resilience and a few other things, because we thought they would probably be connected. And then changing MS knowledge would be related to changes in those other outcomes. So we took a look to see if we were right. And if we look at the data that came in from before the course started, so at baseline when people hadn't yet actually taken the course, what we see is that among people living with MS, their knowledge of MS is higher than people not living with MS, but their quality of life and resilience and health literacy is lower. So then we said, are those things related? And we took a look and we did some analysis, and it turns out they're not. So these things are separate going into the course. So then the next question is, does the change in MS knowledge that happens after you take the course because you've learned things, does that have an impact on the change in these other outcomes? Well, it turns out, no. There's no relationship between the change in MS knowledge and these other characteristics that we looked at, despite the fact that all of them improved. So that caused us to change our flowchart. So you can see here on the A side that we have the original hypothesized flowchart where there's a connection between MS knowledge and other outcomes. And then on the right, you can see a revised one where it's sort of MS knowledge is off by itself, and there are connections between these other outcomes, but MS knowledge is not connected. So despite the fact that MS knowledge isn't connected to these other outcomes, MS knowledge is important, and it's important because it's empowering. It allows you to make informed decisions, to ask informed questions, it allows you to pass on knowledge to others, and these are incredibly important things. So this is not to diminish knowledge in any way. I'm a humongous nerd, and I can't sing the praises of knowledge enough. But what it does tell us is that MS knowledge isn't necessarily the only thing you need. If what you want to do is change some of these other outcomes, some behaviors or skills, these are things that we might need something beyond knowledge to accomplish. And we think that the reason the course causes positive outcomes in things like health literacy and self-efficacy is because we've woven in other techniques. And that those techniques, in addition to providing information and increasing knowledge, probably would lead to those positive results that we're very proud of. So if we want to change behaviors, if we want to improve skills, information and knowledge isn't enough. We need other tools as well. And on that note, I'm going to pass it over to Jodi to talk about what this means.
Oh, I've missed Kevin Bacon. I don't know, Francis Bacon. Kevin Bacon. It's a very funny 80s joke there. Hi. Anyone in the 80s should have had a little chat. So I guess when I found out this information, Suzi was talking to me about the research, I thought, well, from a services perspective, we've sort of lived in this paradigm for a long time that we teach and teach and give knowledge, and that's what works. And so I guess being an MS nurse for 20 years, I had enough stories to know that that was probably not the truth. And that it didn't surprise me at all that people with MS had great knowledge coming into the course. And so, like Suzi, that wasn't surprising. So I guess it spoke to me about what we need to do in clinical services and in services as healthcare professionals and services as MSL. How do we sort of support people to build self-efficacy and health literacy and those other things? Now, I don't have the answers. I wish I did, and I'm working on it. But I think it sort of spoke to what is self-efficacy and how do people feel. To me, self-efficacy is when people talk about feeling in control. Feeling in control of their disease. They've got their plan, they have the right knowledge, but they also have the right team, and they also have the right resources around them. And how do we help people gather that sense of self-efficacy? Because if it's not just knowledge, where are the gaps? And if you think about self-efficacy, you think it's a product of your health story. We don't talk much about our health story, but it has such a huge impact on how much sense of control we have over our disease. I mean, your health story is, how you grew up believing about taking medications is a classic example. If you grew up with your mum saying to take Panadol, you'll be okay with medications potentially. But if you grew up with a person who's never taken medication, you're going to have anxiety around that. And so so self-efficacy and our sense of control over things and power to be autonomous in decision making is a lot to do with what our values are and our health story as well. So helping people understand that can be really useful. So I had a look at the usual behavioural psychology, which is 4 ways to improve self-efficacy. I like the words, those 4 ways, 8 ways, 6 ways. But this one I thought really, this one was a sense of, you feel a sense of power, you feel a sense of self-efficacy if you had a mastery of experience. You've taken it on, you walked that walk, run, roll, you did that 5 kilometres and you can do it. And so that's a great sense of feeling, I've done this once before and I know I can do it again. Vicarious experiences is another way that we have a sense of self-efficacy as well too, and that's where the value of peer groups is so important, because if you can see another person have done it, you think, oh, they're like me, I can do that too. I mean, I listening to this morning, I thought I can even be an artist. So it's that sense of matching yourself with someone, and peer groups are really valuable for that. And to have those around you who kind of give you that sort of self-reflection. Verbal persuasion is another way that we have self-efficacy as well too, and that's encouragement. I guess I'm a very passionate MS nurse as well for a long time, and I think nurses are very good encouragers to people to be able to sort of go for their gold and go for their goals, but also other people around you, and that's where setting up right from diagnosis, those people around you are going to be, right in there with your values and what encourages you. And again, I'll use the art story, that person who is cheering you on right from the start about doing that art, doing what's important to you, to give you a sense of control and self-efficacy in your life. And then, I guess, being psychologically or psychologically prepared. And we all know that, when you're depressed and when you're fatigued and when you're feeling all that sense of overwhelm, that readiness to feel empowered and a sense of control, I'd probably put that at number 1, because it's just so hard to kind of reach that level when you're right down there. And sometimes that's just where we need to start. And I think when we think about providing services, even when we think about doing research for people with MS, we should be looking at how does that reflect in this area as well too, because that's, the people who have the best outcomes in MS are certainly the people who have a strong sense of self-efficacy. Then in terms of health literacy, Suzi defined health literacy, but there's very good evidence to suggest that those people with a low health literacy do worse in health. And that's usually defined, we often think of health literacy as the way that something's explained, that it makes sense to people. I like to take it a step further and think health literacy is also how people make sense of it to them in their personal context. And that's often a one-to-one conversation. It's often that one-to-one sort of sitting down with someone to sort of really, how does that actually fit in with me? How does that fit in with the symptoms I'm experiencing? How does that fit in with how my values and where I live my life? And so I think that's a real aspect of health literacy that's often ignored. You can have nice, pretty pictures and explain things really well, and just listening to the beautiful explanation of genomics there was just, that was just magnificent from health literacy, thank you. But I think we've got so much better at that as healthcare professionals, but there's a long way to go to that next level that people are able to sort of embed it in what that means for them personally. And the other thing I think a lot about when I think about health literacy is that aspect of the health literate organisation. And that's about, that sense of self-efficacy comes from knowledge, but also knowing what to do when. And that's a little bit about not what you know, but who you know. And I'm sure my children will say to me that's going to be on your epitaph, because I always say, it's not what you know, it's who you know. And so it's about sort of helping people understand how to navigate the systems, because that's so important. And I think Heathrow Airport is a classic example of how they actually improved the literacy of that airport, because you would get there and be completely confused, and then some brilliant person came along and made one whole section that's all purple and one's all orange and one's all blue, and just made it so much easier to navigate. And healthcare systems are really complicated. They're not literate systems. And that whole concept of what to do when and how to do it. So that's another part of health literacy that I think is really important to be able to incorporate with knowledge, and they fit together so nicely, and they can really be communicated with each other as well too. You need to have that knowledge. It's so important. So it's such a part of our jobs as services to do that, but it's also able to give you the rest of that health literacy, so you feel like you have the language that you need and the resources that people with MS need. So that's really the call to action for us as services, to be able to support people doing that, taken from this wonderful research where we could work together and learn together, which is the best way to do it.
Absolutely, and if you are interested in getting involved at all, you can enroll in the Understanding MS Mooc and take part in research yourself. You can spread the word about the course, or you can help us create new short MOOCs, which we're working on 4 separate short MOOCs, and if you're interested in taking part in any of that, please come talk to us at the trade tables. Thank you so much.